Well, hello there. So I was doing some research on Medicare and I was like, okay, this is odd. This is different. So in today's video, we're going to go over the most odd, shocking things that Medicare covers. So let's dive right into it. So these are very interesting, but I would definitely say that if you need any of these services that I mentioned, then yeah, go ahead and check it out. These are things that Medicare absolutely covers. So talk to your doctor and see if some of these services will actually benefit you. And yeah, this one can be a little shocking and I'm like, what? So Medicare does not cover physical exams, I know, but they do cover yearly wellness visits, okay? So after you've been on Medicare for 12 months, then you could go ahead and schedule a yearly wellness visit with your doctor, and this is covered by Medicare. So your doctor will have you fill out a health risk assessment. It's going to be a series of questions, and with that information, they can develop a care plan for you, a plan of care to figure out, okay, this is the treatment that we're going to use for your care for the following year. So yeah, Medicare covers yearly wellness visits, not physical exams. Physical exams is a little more detailed with lab and tests and such. So Medicare does not cover that, but they do cover yearly wellness visits. And like I said, with that, you would answer a series of health questions and that will determine your plan of care. That will help the doctor determine what actions, what treatments he needs to put in place to help you stay healthy. So yeah, that's the first thing that is kind of shocking, that Medicare covers the wellness exams, not physical exams. The next shocking thing that Medicare covers is bone mass measurements, okay? So you can get this done every 12 months to see if you are at risk of broken bones or brittle bones. So this is great. This is to help you stay healthy, stay active, keep your bones nice and strong. So yeah, Medicare does cover this. And of course, it has to be medically necessary. So if you're showing signs of, problems with your bones, maybe rheumatoid arthritis or anything like that, or if you have a history in your family with women in your family with lower bone mass, Medicare covers this service. So talk to your doctor about getting a bone mass measurement, and you pay nothing for this test if your provider does this service and accepts Medicare assignments. So like I said, check it out. You pay nothing and it keeps you nice and healthy, keeps your bones nice and healthy. So the next thing that Medicare is going to cover is clinical research studies, okay? So you may want to look into this. Let's talk about it. So if you have a medical problem that, the doctor is having a hard time figuring out what's best for your situation to help treat that medical condition, then you may want to do some clinical research to see what works for you. So basically, clinical research is tests that tests how well a study or a test or a treatment works for an individual with a certain condition, and if that clinical research or that test or that procedure or whatever that treatment is, if it's actually safe. So if you have a condition and you're having a hard time finding treatment, your doctor is having a hard time finding a treatment, then you may want to get involved in clinical research because this is covered by Medicare. Another thing that Medicare covers is eVisits. So what are eVisits? So eVisits is when you actually communicate with your provider or have a physical appointment with your provider without being there physically. So it's through an online patient portal, almost like telehealth, but it's through an online patient portal. So you can have these online interactions with your providers, such as your doctor, your nurse practitioner, your nurse, your physical therapist, your speech therapist, your occupational therapist, and your social worker. So this is a great tool, a great service that Medicare is providing. So if you cannot get to the provider due to transportation, or maybe you're just too ill or sick to get out of bed, then look into that. Or it may be because you live in a rural area. So Medicare is providing this service. It's called eVisits. So definitely check it out and talk to your provider if they provide this service. Another thing that Medicare covers is a great service. If you need the service, do not be embarrassed because, hey, Medicare covers it. And if you need this treatment, then I would definitely seek out help. And this is opioid disorder use treatment services. If you are addicted to a, substance, then you definitely should reach out to your doctor and see if you can get this service. See what clinics in your area that actually provides this treatment for individuals that's having a problem with opioid uses, okay? So I'm going to read directly what it says because it is a lot of information here. So it says Medicare pays doctors and other providers for office-based opioid use disorder treatment, including management, care coordination, psychotherapy, and counseling activities. So like I said, if you're having a problem with substance abuse, do not be ashamed. Get the help that you deserve, that your family deserves. Your family wants to see you get better, and Medicare covers this service. So I highly recommend that you look into this, see what treatment centers, clinics are in your area that takes a Medicare assignment that can actually help you in your recovery. This is a great thing, nothing to be ashamed about. I love it, and like I said, if you need this service, definitely seek out the help because the help is there for you and it's covered by Medicare. So yeah, please take a moment to like this video, give it a big thumbs up if you are enjoying the content. It really helps others to find this video and it helps the channel a lot. Thank you so much. Moving along. Another shocking thing, but a great service that Medicare covers is nutrition therapy services, okay? Medicare covers nutrition therapy services. Let's talk about it. So if you have diabetes, if you have chronic kidney disease, or if you had a kidney transplant in the last 36 months, Medicare will pay for this service to help you get on track when it comes to your nutrition. And this service has to be provided by a registered dietitian. So I would definitely look into this if you have diabetes or kidney disease. This will help you get back on the right track when it comes to managing your chronic condition. So yeah, look up this service in your area. Look for a registered dietitian that is able to bill Medicare, so that way you can get the help that you need when it comes to your nutrition, maybe help you lose some weight and help you manage your chronic condition. Like I said, for diabetes, for kidney disease, and if you had a kidney transplant in the last 36 months. I think this is a great service that you should definitely take advantage of. So yeah, Medicare covers this, and that is great news. Medicare will also cover this shocking great service, and this is called Principal Care Management Services. So if you have a chronic condition, like I said, that put you at risk for hospitalization or death like cancer, then Medicare will actually cover for this chronic condition management, right? So how this will work is that Medicare will pay a qualified provider to help you manage this chronic condition. So talk to your doctor about this service and see if they could help you with this, or if they could refer you to a clinician that actually provide this service. So like I said, if you have a chronic condition that puts you at risk of hospitalization or death for more than 3 months, then check out this service. Medicare will cover this shocking item, and this is a prosthetic or a orthotic item, okay? So if you're missing a limb, like a leg or arm, or even an eye. I have a client right now that's getting this done. He needs a prosthetic eye, okay? Medicare will cover this service, of course, if it's medically necessary. I mean, if you have a missing arm, it's going to be medically necessary. But it's good to know that Medicare covers this. So if you need a prosthetic device, like I said, an arm, a leg, an eye, even if you had like your breast removed, Medicare will cover this prosthetic device. So definitely check it out and talk to your doctor about this service so that way you can get this approved by Medicare because, hey, Medicare covers it. So definitely check it out. Like I said, Medicare will cover these prosthetic items, these devices that is needed to enhance your everyday life. So yeah, check it out. Another thing that is pretty shocking that a lot of individuals probably don't know about is that Medicare offers a welcome to Medicare preventative visits in the first 12 months that you are eligible for Medicare Part B. So once you get Medicare Part B, you have this benefit, this welcome to Medicare preventative visit. So what would this visit entail? So it's basically like a counseling session, education session that basically go over your overall health to talk about how to keep yourself healthy, what are the preventative services that's out there, preventative tests that you can get done, vaccinations and such. This is a great welcome to Medicare preventative exam or visit with your doctor. If you are new to Medicare, I will highly recommend that you ask your doctor about this visit so that way you're educated and you know what are the services out there for you when it comes to preventative care and, like I said, vaccinations and such to keep you healthy. This is available to you in the first 12 months that you are new to Medicare. Hint the word welcome to Medicare preventative visit. In this welcome visit, you should also get information on anything that will put you at risk of getting sicker as you age into Medicare. So it could be talking about the reasons why you should smoke tobacco, alcohol use, substance abuse, diabetes, counseling, anything that can help you stay healthy and help you with preventative care. That's what this welcome visit should be about. So yeah, definitely check it out. Thank you so much for watching today's video. I hope you learned something new today. If you like the video, please give it a like. And if you know anyone that needs this information, please share this video. If you have any questions, leave them in the comment section below and I'll be more than happy to answer your question. If you need any assistance, give our office a call. We'll be more than happy to assist you. At the end of today's video, there are 2 videos that you can also watch. Thank you so much for watching. Please subscribe to see me again, and I'll see you on the next video. Thanks for watching. Bye.